I'm Dr. Anna Juricic, your low vision optometrist and the creator of the Vision Enhancing Method. And today I want to talk to you about diabetes because the month of November is Diabetes Eye Disease Awareness Month. And whenever I have a patient who has diabetes, I often will ask them about what nutrition they have in their regular diet every day. And a big thing that I want to know is, are their blood sugars under control? It's so very important that you have to keep the blood sugar level under control. And if you can keep it under 7, you usually are keeping most of your doctors happy. And the big thing is not to have the fluctuation so much in the blood sugar level as well. So on average, it might be 7, but if it's dropping down to 4, going up to 13, that's a lot of stress and strain on those small blood vessels that are within your eye. And so the best way to avoid any of the complications that are often talked about with diabetes, which is diabetic retinopathy, is keeping that sugar level around that 7 mark. It's okay to go a little bit up and down, but not dramatically. And if you can keep it under 7, that's going to be really good, and you're going to keep your doctors happy. It's also really important to be seeing your eye doctor at least once a year, and that's either your ophthalmologist or your optometrist. And for some cases, they have to see you more often, especially if they've seen some changes, some little tiny bleeds or hemorrhages at the back of the eye or other changes. But what I've included in this newsletter that you would have received as part of the educational platform that I'm offering is actually, I've talked about nutrition. And so one of the things I'm often specifically asking the patient, are you eating a lot of white potatoes, white rice, white pasta, white sugar? Because many people know you have to minimize your sugar, and they might be cutting out the desserts, keeping the fruits a little bit at a lower level. However, they may not know that having white potatoes, white pasta, white rice is just like eating sugar. So I recommend, instead of white potatoes, you're eating sweet potatoes or yams. Instead of having rice, you might want to think about cauliflower rice or some of the substitutions that are out there. And in terms of the white pasta, getting alternative pasta sources as well. Some people like even doing the zucchini pasta, where it's like the zucchini spaghetti. But that's one way. These are some great ways that you can introduce into your everyday diet of how to minimize other forms of white sugar. And definitely stay away from any of the soda pop, even the ones that are saying diet. There's a lot of sugar or sugar substitutes, and it's not good for your body and keeping that sugar level under control. But what I want to do is mention a quick excerpt from a wonderful book by Dr. Laura Capano. She's one of my colleagues and optometrists in the Niagara Falls region. And this is one of her more recent books called Eye Foods. It's a complete eye health and nutrition guide. And she has great tips for individuals with diabetes. So I'm just going to read it out to you. So her eye tips are: fill your plate with eye healthy fruits and vegetables, including a handful of raw leafy greens each day. Half cup of cooked leafy greens twice a week. Half cup of orange vegetables, such as squash, carrots, pumpkin, or sweet potatoes most days. 2 orange bell peppers per week, raw and or cooked. Half cup of green vegetables, such as raw and cooked broccoli, Brussels sprouts, green peas, green beans, asparagus, zucchini, and you can have this every day. Up to 3 servings of kiwi fruit, avocado, cantaloupe, citrus fruits, or berries per day. A serving is 1 medium fruit or a half cup or 125 milliliters. Avoid fruit juices and dried fruits as they are very high in sugar. Include whole grains in your diet daily. Good choices include quinoa, barley, whole grain bread, and whole grain pasta. Monitor serving size. 1 serving is a half cup. Choose lean meat and poultry, such as turkey breast, chicken breast, and lean cuts or beef. Use healthy oils such as olive oil. So these are just some tips that she mentions on page 66 of the Complete Eye Health and Nutrition Guide, Eye Foods by Dr. Laura Capano. So hopefully this will give you some added tips if you haven't already been including it in your diet. So these are healthy tips. even if you don't have diabetes, if you do have a family member or loved one with diabetes, really encourage that they actually monitor what they eat. This is the best way to avoid any of the complications that they or you may have heard about diabetes. So until next time, thank you for watching. Bye bye.